My name's Patrick Withrow. I'm a retired cardiologist and internal medicine doctor. I work at Baptist Health Paducah, and we're going to talk about addiction and ramification of opioids. My experience with this is as a cardiologist and internal medicine doctor who is interested in this. I'm not a counselor. I don't treat patients with this. But, I have been interested long enough that I have put on an addiction seminar for 11 years, so I've learned quite a bit about it. There are certain aspects of personality which tend to pick and choose which individuals are likely to do this. Thrill seekers, depressed people, impulsive people, and really sensitive people. And oftentimes, if their personality is right and if they take enough of the drug often enough, they're addicted sooner rather than later. Even within a week. Mother Nature gave us a reward or pleasure pathway to make sure that the human race actually propagated itself and was healthy. With opioids, with addictive substances, these hijack the brain. They basically hijack the reward center and the pleasure center. If we take something like opioid, a tremendous amount of dopamine is released into the pleasure center and the reward center. So much that it's just such a wonderful, wonderful feeling. The first time this is used, it's a tremendous amount of dopamine is released. And so this sets us up for a future of addiction. If we have a rewarding experience, we will remember that. That is stamped into the memory of the reptilian brain in the hippocampus. We will remember that. And that's where craving occurs. So if someone uses drugs over and over again, they will have a certain amount of craving, and they will desire that every now and then. And craving, the best way I can explain it is if I took you or another individual and put you in a room with no water or no food for 5 days, you would develop tremendous craving. You would do anything for water and food. That's what happens if you have to have more and more and more drug. You develop the tolerance. When you take it away, tolerance goes away, and that's where drug overdoses and deaths occur. Overdose deaths occur more often than do automobile accidents. But nonetheless, we're heading down the wrong path, and it's a scary situation. It's never totally gone. Every day is a new day. It's one day at a time. We have medication-assisted therapy. That's about the best treatment that we have these days. That plus Core 12 or a 12-step program, which also is a method to engage the cortex. An individual has to develop a program of spirituality, something greater than self, some sort of means to keep them from going back to the original drug. It requires a lot of work, especially with opioids. These are some of the most addictive substances known to man. They are the solution until they become the problem.